Hello, Matthew Judson, JSP Ltd's Respiratory Director. What we're going to look at today is some face fit testing, and in particular qualitative face fit testing, or what some people call the bag on the head test. What we're going to see in the following video is a compressed version of the test to give you some idea of what is involved. In no way is this supposed to substitute for having the proper training done. JSP Ltd have several Fit2Fit accredited testers working for us, and we can come out to your site and train the tester, or you can come to our head office down in nice sunny Oxfordshire. The first thing we need is a test subject, so Muti here is going to be our test subject for today. And what we're looking to do is to fit test him to make sure that the respirator that we have for him is actually providing the right level of protection for him. So when you're doing a fit test, the first thing is to explain to the wearer what it is you're going to be doing. Hi Muti, what we're going to do today is to do a fit test on you to make sure the respirator we've provided you with is actually fitting your face. Yes. Everyone has a different shaped face, all the masks are different. We need to make sure the one you've got is actually giving you the right level of protection. Yes. So in the box you have your two nebulizers and your bottles of sensitivity and test fluid. And what we need to do when we're filling the nebulizer is, if you take it out, make sure it's unscrewed, fit the nebulizer into the foam so that it can stand up, and we can then put the solution into the nebulizer. Give the bottle a good shake to start with to make sure that any crystals that have come out solution are dissolved, and then pour that into the nebulizer. So now we've filled the nebulizer, if we take it out of its holder and screw the top on, and before we go to do a test, one of the things we want to do is to make sure that the nebulizer is actually working. So remove the intake port cover and remove the exhaust port cover. Give the nebulizer a complete squeeze and make sure that we get a cloud of the atomized mist coming out of the nebulizer. So Muti, the first test that we need to do is to check whether or not you're sensitive to the solution that we're using. Yeah. What we're doing to do the test with is to use some sensitivity solution, yeah. And this is primarily water, but it has a small amount of a chemical called ditonium benzoate in it, okay, which is a bitter tasting solution. So often this is called a Bitrex test, which is a trade name, very much like Hoover is for vacuum cleaners. Okay, yes. It's a taste test, so when we're doing the test you need to be breathing with your mouth open so that we can taste it. Yes. Okay, it has, as I say, a bitter taste, so when you taste it I expect there'll be a visual reaction on your face, but also need you just to put your hand up to say yes, I can taste it. Okay, yes. So the sensitivity test that we will do is we'll put the hood on your head and we'll then spray into the chamber that we've made around your head, yes. 10 squeezes of a nebulizer. Yes. Hopefully within those 10 squeezes you'll have tasted it. If not, we'll then carry on up to 20, and hopefully sometime between 11 and 20 squeezes you'll taste it. If not, we'll keep going, and hopefully you can then taste it between 20 and 30. Yes. If we get to 30 and you haven't tasted it, you're then insensitive to the solution, not insensitive, and we'll need to look at a different way of doing the testing, something like the port account quantitative fit test that we can provide. Yep. Okay, so the first thing we're going to do is, without any of the PPE on, because we're trying to test whether you're sensitive, is to put this hood over your head to create a chamber. Okay. Before we do that, I just need to make sure that you're not susceptible to any asthmatic type medical conditions. Excellent. Okay. And you're not pregnant at the moment? No? Okay. So put the hood over. Make sure we get it down around the back and on the shoulders, and then tighten up. Not too tight so that it chokes the chap, but just enough to create a chamber. So taking the nebulizer out of the box, we'll take the top off, and then we will pour some of the solution into the top of the nebulizer. Okay, having filled that to the required level, we'll screw the top back on, and screw it down tight onto the O-ring. What we need to do then is to remove the intake port cover, to remove the exhaust port cover, and then just to make sure that we are actually getting some dust coming out of the nebulizer, which we could see there. So now, Muti, if you can breathe with your mouth open, and when you can taste the aerosol, please give me a hand signal, and I expect I'll see your face grimace as well. 1, 2, 3, 4, 5. Oh, excellent. So we've got a very good reaction there, and Muti is clearly a sensitive chap to that. So what we do now is remove the hood from his head. Okay, and we'll then give the test subject 15 minutes or so to go away and get some of that taste out of his mouth before we start to do the test. So your taste bud's nice and clean now?
Yes.
Okay, you've got rid of that taste. So what we need to now do is actually do a fit test to make sure that the respirator we've been provided you with does actually do the job.
Yeah.
And as I said earlier, is there any other PPE that you would normally wear during your working day?
Yes, I do wear these glasses for the eye protection.
Magic. So we need to put those on and then get the respirator. What sort of respirator are you provided with?
I use this.
Excellent. So we've got a JSP 325 respirator. So if you can put that on in the way that you would normally put the respirator on. Now what you can do during this point is to actually provide some training to make sure that the test subject is putting the respirator on in the correct way. Most people should have been trained how to put the respirator on before you get to this point, but just in case, you can use this as a way to check. So what we can see there is Muti's adjusting this mask well. He's pressed the nose bridge in, he's now adjusting the harness. What you might have noticed there is that he had to adjust his spectacles to get the mask to fit. If that's a problem you've got, you may wish to consider using the JSP Filter Spec product, which combines respiratory and eye protection in one device. So, is that all comfortable and fitting okay?
Yes.
Excellent. So what you can do at this point is just have a quick check to make sure the wearer's got the mask on in the right way. So Muti, if you could look down. And what I'm looking to do now is to see around the nose bridge of the mask to make sure we've got a good seal there. And if you could look up for me, please. And looking up underneath the chin there to see that we've got a good fit around the face. Excellent. So you're happy you've got a good comfortable fit and a good seal on that mask?
Yes.
Excellent. Right. So now we'll put the hood back on and start to do the tests. So if we can, there we go. So when you're tightening the hood, we're not looking to tighten it to such an extent that we strangle the person, just to make a nice comfortable chamber around the head, and just make sure we've got it pulled down nicely at the back so that it fits well, and we just adjust that to do that. Okay, Muti?
Yes.
So what we're going to do now is we're going to go through a series of tests. We have a normal breathing exercise, then deep breathing exercise, a head side to side exercise. So you don't want to be moving the head too fast, just that sort of speed, and then a head up and down exercise. Then we'll do a talking out loud exercise, a bending exercise, and then back to a normal breathing exercise. Okay. Each exercise will last for a minute, and we won't start the clock until after I've put the initial squeezes of the nebulizer in. When it comes to the talking and the bending exercise, we'll stop the clock while we put the aerosol into the chamber, and then start again for 30 seconds before stopping the clock and then carrying on.
Yes.
Okay. So having removed the protective covers from the ports of the nebulizer, just check that we're getting a cloud of dust coming out, and we'll then blow it in. So breathing with your mouth open. 1, 2, 3, 8, 9, 10. So just breathe normally, please, Muti. So all we did then was I squeezed in 10 squeezes of the nebulizer. When we did the sensitivity test, Muti was 10 squeezes sensitive. If he'd been 20, I'd have had to initially squeeze in 20 squeezes of the nebulizer. After 30 seconds, we then need to recharge the atmosphere within the chamber. But what we'll do now is only half of the initial number of squeezes. So in this case, just 5. Please make sure you're breathing with your mouth open, Muti. So he then carries on breathing normally for another 30 seconds. At the end of that 30 seconds, we'll now say, please breathe deeply, and squeeze in another 5 squeezes of the nebulizer. As we're going through the test, we need to periodically just check that we are still getting a cloud of aerosol coming out of the nebulizer. After 30 seconds of deep breathing, we then squeeze in another 5 to keep the atmosphere charged. And then after he's done that for 30 seconds, we then ask the test subject to start moving their head side to side and squeeze in another 5 squeezes of the nebulizer. And again, in the same way, that will continue for 30 seconds. We squeeze in another 5. And at the end of that minute, we then move to going head up and down, please, Muti. All the way up, that's it. Yep, and down. And squeeze in another 5 of the nebulizer. 30 seconds later, another 5 squeezes of the nebulizer. And again, just a quick check to make sure we're still getting the mist coming out. If at any point during the test you find you're not getting a mist coming out, we would need to stop the test and start the whole thing again. After those 30 seconds, we then ask Muti to do a reading exercise. Now in the package, in the user instructions that come with it, you will find the rainbow passage. Here we've got a slightly bigger version so that he can actually read. But before we start doing that, we need to squeeze in 5 squeezes of the nebulizer. And then if you could please read out loud, Muti.
Rainbow passage.
Now, because it's difficult for Muti to actually be reading while I've got my hands in front of him, we had to stop the clock. After those 5 squeezes, we start the clock again, and he reads for 30 seconds, and we'll then just say to him, please pause while I re-energise the aerosol. And now please carry on reading. It's important during the reading out loud test that the tester can actually hear the subject speaking and that he keeps reading. If he gets to the end of the speech, then he needs to start again. If your subject is not happy to read the prepared passage, they can always count backwards from 100 to 1. It's a much better way of doing it than going 1, 2, 3, 4, 5, 6, 7, because the face doesn't move enough. After that, thank you, Muti. We will then squeeze in another 5 squeezes of the nebulizer, and then we're going to ask Muti to hold on to the hood as he starts to do the bending exercise. So if you can cross your arms to hold the hood, and as the tester, if you just hold the back of the hood to keep it in place. Please bend as if to touch your toes. Excellent. And we then do that for 30 seconds. And after 30 seconds, we'll say, please stop, while we put some more atmosphere into it. Please carry on bending. So just holding the hood to make sure it doesn't fall off the back. After 30 seconds, We'll then say, please stop Muti, and just stand and breathe normally. So this is the final part of the test as we allow the test subject to relax and get towards the end of the test. Again, it's another 1 minute of doing this exercise. So after 30 seconds, another 5 squeezes of the nebulizer. So just 30 seconds to go, and so far Muti hasn't tasted the aerosol at all, which is an excellent result for him wearing this JSP 325 respirator. Muti, that's the test completed. We put the nebulizer back, and we'll now remove the hood. There we go. Thank you very much. If you want to remove the respirator and your eye protection. Now, what you just need to do is to brief the test subject. We have been spraying in the Bitrex solution.
Yes.
I would advise that you now dispose of the respirator because it's contaminated, and that you go away and give your face and hair a bit of a wash because that will be in your hair. Certainly, please wash your hands before you you eat anything.
Yes.
Okay. Once you've done that, if you can come back, and then we can complete the test record form.
Yes.
Thank you.
Thank you.
So, obviously, once we've done all the testing, it's pointless doing this testing unless we have a record form to go through. So what we're looking to do on this form is to have details of the test subject, the tester, what mask he was wearing. Very important that we put the mask down. The test fit is all about making sure a particular user fits a particular mask. It's not a universal test, it's only for that individual. So, the testing that we've just done, it was a very compressed version of what we would normally do. And it's really here as an aid for you to understand what it is fit testing is about. As I said at the beginning, if you need to have train the tester training, JSP can provide that through one of our Fit2Fit accredited fit testers. Thanks for watching.